Singapore has seen its first locally transmitted cases of the novel coronavirus. They occurred in 4 patients who had not recently travelled overseas, and they're among 6 new cases announced today. And the cluster of 4 cases are linked to Chinese tourists who visited a health product shop in Cavan Road. The cluster comprises 2 shop assistants and 1 tour guide who are Singapore residents and 1 foreign domestic worker. The tour group arrived from China on the 22nd of January. They visited the shop a day later, then left for Malaysia. They returned to Singapore on the 27th of January and departed for China a few hours later. Singapore's travel restrictions kicked in the next day, the 28th of January. Now, when CNA visited the shop at Cavan Road, it was shut with no activity. We're told that it's very popular with tourists from China, with visitors arriving by the busload. Now, the 2 other new confirmed cases were among the 92 Singaporeans who returned from Wuhan on that scoot flight last Thursday. Today's new cases take the total here to 24. Now, as of noon today, there were 20 cases pending test results, and the latest figure of people under quarantine is 524 as of yesterday. Authorities have emphasized that there is no community transmission of the virus here in Singapore. That's after 4 locally transmitted cases were confirmed. CHERYL Go tells us more.
The source of local transmission for 3 of the cases has been traced back to the prolonged contact they had with travelers from Guangxi in mainland China. The 4th was a close contact of one of the earlier 3. The Health Ministry has started contact tracing to identify close contacts given the chain of transmission and said this will ring-fence the cluster and limit further spread. The fact that authorities were able to pinpoint a specific source of the transmission makes containment efforts easier.
There is limited community spread in the community transmission. The idea is that there is a contact source of the infection that is not imported. So there is a secondary transmission from one of the infected person to a local, so both are locals. So this is therefore a limited community spread, but it is not a widespread community transmission. And the main difference is that for this particular cluster, we are able to identify all the contacts that are involved, including the source of the infection. As I mentioned, they were involved, they were in contact with a group of Chinese tourists from mainland China, and this particular group of mainland China tourists, we were able to have their names, and we have indication of who were the individual patients that fell ill and were confirmed as a positive case for this novel coronavirus. When you have cases popping up in different parts of Singapore, different clusters occurring, and you may not be able to determine the source of these clusters. You can have a few cases where you have no idea where these cases come from. They do not have a specific source. Then you have a widespread transmission.
Current evidence suggests that the virus is mainly spread either through direct or indirect hand contact with droplets from infected individuals. The virus can also be transmitted through surface contact. This makes hand and personal hygiene all the more necessary. Mr. Gan added such local transmission is not unexpected, and authorities are ramping up to contain the risk. Since last week, the Health Ministry has started testing all pneumonia patients in public hospitals as an added precaution. The enhanced surveillance has led to one of the local transmission cases to be identified.
We're able really to take the sequences that have been published and to create rapid diagnostic kits and to rapidly scale up the numbers so that we are able to diagnose the cases early. This is quite different from the situation in SARS, because in SARS actually for the first 5 weeks or so we did not have any diagnostic kits, and that made the whole containment effort much more difficult.
Prof. Tan adds a number of local patients are currently being treated with some HIV drugs with promising results.
Well, earlier on News 5, my colleague OTELLI spoke with Associate Professor Kenneth Ma, Director of Medical Services at the Health Ministry, and we began by asking him at which point would it be determined to be community transmission.
The last few cases before today were cases that occurred in patients or people with a history of travel to China, or more specifically to Hubei province. The few cases we've seen today, in fact, changed that trend. These are people who have no history of any travel to China, and in fact, when we did contact tracing, we found in fact they were linked with a travel group that themselves had come from China, and we believe that's how the transmission has occurred. The cases all seem to be related to this same link, and we can account for that this form of transmission. So while this is a local spread, we don't think at this point in time that we have any evidence to suggest that, in fact, there are other people who are spreading this illness in Singapore. What I'll be looking out for would be whether or not there are any other cases that come on that are not linked to this particular group of patients or to the group of travelers that come from China, this particular group. And if I cannot account for any link with travelers from China, that raises my concern that there may therefore be someone else in the community spreading. That constitutes community spread.
Okay, got it. So let's just talk about contact tracing. Can you just give us a little bit more clarity about that? Because not much information is shared about the tour group, about these locally transmitted cases. Can you just tell us how exactly contact tracing is being done?
Yes. Well, contact tracing still continues for this group of people, so the information still continues to come in. We don't have all the information in just yet. But in general, what we do with contact tracing is first to interview the patients that we have, to find out what their movements are like, where they've gone, and in fact, sometimes we also corroborate that with checking phone records, travel records, taxi records, and so on. And once we get a picture of where they've gone, we then find out who they've been in contact with. We then contact these individuals and people they've been in contact with, find out how they're doing, whether they're sick, whether they're well, and assess their own individual risk of being exposed to these patients. That allows us then to decide what to do with them.
So we know that there are 524 people being quarantined in Singapore right now. In terms of those for close contact tracing, what are your latest figures on that?
My understanding is that contact tracing continues. I think that we've had about 311 people that continue to be on our contact tracing.
Well, the other thing I want to ask you is about the fact that there is a 14-day incubation before anyone shows any symptoms.
That's correct.
Isn't that worrisome?
Well, it is in the sense that it means we need to keep individuals under surveillance for that 14 days. And in fact, from the time that this outbreak has occurred, the people that we still have people in the community that are within that 14 days that we continue to keep a close watch on. As you know, we've in fact put in some travel restrictions, and we've put in various measures to perhaps limit the at-risk group of people that are present in Singapore. But the cases so far that we see, in fact, relate to people who've had exposure to travelers even before travel restrictions have taken place. So from that perspective, we think there may still be that possibility of more people coming out with symptoms and subsequently being diagnosed with this infection.
Now, let's just talk about the origins of the infection for all the previous 18 cases. Can you confirm that they are all imported cases?
Yes, and they all have a travel history linked with Hubei province. In fact, very specifically, most of them, in fact, had specific travel from Wuhan city.
Also, let's just talk about the yellow level of the government's DORSCON framework. What does this mean? And I'm just wondering, what will it take to bring us to the next orange level?
Yes. Well, we have a risk assessment system which allows us to assess what the risk is of spread in the community. At this point in time, we remain in what we call DORSCON yellow, and that means that there is no signs of any spread from cases that we cannot account for in the community.
Professor Mac, perhaps you can just elaborate more about, you've mentioned what it takes us to get up to the orange level, but what kind of added measures and actions will orange level actually bring?
If we move into what we describe as DORSCON orange, that means we believe that there's spread of the infection in the community itself. It would be reasonable then to consider a suite of measures which includes some degree of social separation. That may include discouraging members of the public then to gather together in crowded areas. We would give serious consideration whether to cancel mass events, and we would also, in particular, encourage some level of for business continuity in companies, making sure that they, in fact, have sustainable practices that allows them to continue their practices if any employee or any individual in the company then gets sick.
Can you just also help us understand about this enhanced screening for all pneumonia patients in Singapore? How many cases do we have at present? And I'm also wondering if this will actually create existing burden on the current healthcare staff.
We currently have patients, in fact, who are admitted in hospital for pneumonia, and on average that would be somewhere between 500 and 600 patients admitted in the hospitals per week. What we have done, in fact, is to investigate whether any of them possibly could have pneumonia due to this infection. So in addition to the normal investigation and tests that they are currently have, we've now started adding a test for this particular virus as well.
Now, from China's side, we hear that their situation is going to peak sometime this week or the next week. Whereas Singapore, we are sort of, what the Minister Gan Kim Yong says, we are prepared for a long-haul fight. Can you just elaborate what kind of timeline are we looking at?
Yes. Well, we are very encouraged by the Chinese saying that they believe that they may have some control on the outbreak they have, and they hope, therefore, that this might peak within the next few weeks. We've noticed that when it comes to the trend of cases that come out, we lag China by a few weeks as well. So while they are confident that they may have control, we continue at this point in time to still continue seeing an increasing trend of cases. And therefore, we continue to be on our guard to make sure that if any cases come, there is no spread into the community. And therefore, our measures are intended to do this.
Right. So again, timeline for Singapore, what are we looking at?
So we think there will be more cases that will come out, and these cases would be related to some form of exposure to travelers from China that may even have taken place before we impose various travel restrictions. So that risk still remains related to the pool of travelers that continue to be in Singapore. But if the number of cases peaks, that may take place perhaps in a few weeks' time, not so soon.
Okay.
With the experience from previous outbreaks, both in Singapore as well as internationally, we know that it's not always easy for an outbreak to settle very quickly, and sometimes it may take as long as 4 to 6 months or even longer. So from that point of view, it's quite reasonable to prepare ourselves for that long haul in case, in fact, it does continue for that long.